So, telehealth uses telecommunication to deliver healthcare. It uses technologies such as phones and videos, smartphone applications, computers, patient portals, home monitoring devices, things like that. And telehealth connects a lot of people to different things like other people or to resources or organizations. So, examples would be like a general practitioner seeing a patient may need to use telehealth to connect to a specialist at a different hospital, or maybe an organization needs to connect to another organization. And what I always think of with telehealth is connecting us patients to providers. So, telehealth can be really helpful in managing chronic conditions. So, thinking of like congestive heart failure or diabetes, things like that. It can also be super helpful in managing patients' medications. So, helping them know when to take their meds, how much to take, track side effects, things like that. Um, it can also be used as a triage system. So I think about the pediatric office I used to work for. They had a nurse advice phone line that parents could call and um, basically talk to a nurse and see if their kid actually needs to be seen or not. Um, Telehealth can also be used for remotely monitoring patients. So whether this is in an ICU setting, where someone's just monitoring like the machines that a patient's hooked up to, or like we see in the hospital all the time, the AVASures that has someone remotely monitoring a patient for their patient safety. And telehealth is also super convenient for people who can't get out and actually get to the doctor, whether that's a transportation issue, a rural living issue, or maybe they have a condition where they can't leave their house or have a child on a vent or something like that that they obviously can't leave at home. Um, and Telehealth can also be super great for access to psych or mental health resources, especially nowadays when it's super hard to get an appointment with a provider. That can be a really awesome lifeline for some people. And telehealth, of course, doesn't always treat sick people. It can be used for health promotion. So you can use things like fitness apps and fitness tracking and stuff like that, as well as seeing a provider for well visits. So through the applications that we've talked about so far with telehealth, we can see that it helps us just have like a broader reach of care to our patients. It can help patients become more involved in their own care. We can provide education to our patients, and just overall lets us monitor our patients more closely. So we learned a little bit about the Health Wagon, which provides mobile services as well as telehealth connection to people in Appalachia. So Appalachia is just a beautiful region that unfortunately has a bad rap, and kind of gets forgotten about. I feel like across the country, I don't think most people realize that there are parts of our country that have such a difficult time accessing healthcare. So many people in this region lack physical transportation to see a doctor. Others just can't find a doctor in the region because there's a shortage of doctors who want to work in rural America. Um, and then a lot of people are in the hard situation where they don't qualify for government health insurance benefits, because they make too much money, but they don't make enough money to actually pay for health insurance on their own because it's really expensive. So that's why the Health Wagon is just so awesome and so important. It brings free healthcare to the people of Appalachia and helps them receive that essential care before their conditions land them in the hospital or even worse, kill them. So health literacy is a patient's understanding of like the information that pertains to their health. So it's important for patients to have health literacy so that they can be involved in their care and be compliant to treatment. So low health literacy is going to just get in the way of patients managing their health conditions adequately. So as nurses, we should ask our patients questions. So ask them about the treatments and medications that they take, about their condition in general, or the care that they're receiving to assess their actual understanding of their health. We should also inquire about their level of education, their learning styles, their readiness to learn, their culture, just so that we can have the best information possible to help them achieve that health literacy. We can also utilize technology and telehealth to improve people's health literacy. You can use things like games or podcasts, give them access to different websites, and just use that technology to help them get involved in their own care overall. So overall, telehealth can help patients and providers effectively manage patients and health conditions while also being super cost effective. And telehealth actually promotes fewer hospitalizations and can improve the quality of a patient's life. As we've seen, it can help us reach patients in remote areas of the country, such as Appalachia, and can improve patient health literacy.